Hello everyone, my name is Nicole Arm, and today I wanted to give you an overview of my final paper, which I chose to do a literature review on increasing vaccination rates in the elderly population. First, I want to define my target population, which is the elderly. For the purposes of this review, encompass anyone who's 65 years of age and older from developed economic countries. This population is at an increased risk of developing more severe cases of vaccine-preventable diseases. Something like pneumococcal, there is 40,000 deaths annually, and older adults account for 90% of the deaths from influenza and pneumococcal disease. However, despite such high death rates, the vaccination rate still falls below the recommended 75%. Vaccinating is an effective primary prevention strategy. Throughout this review, vaccine hesitancy can be defined as refusal or delay in acceptance of vaccines despite availability. As previously mentioned, our elderly population is more susceptible to vaccine-preventable diseases such as pneumococcal or influenza. During this review, I focused on several factors, one of which being the social determinants of health, which could include one's economic stability, education, social context, health and healthcare, and neighborhood or built environment. It is important with regards to public health that social determinants are examined within specific health problems to understand why the behavior occurs. The social ecological model is also used throughout this review. The social ecological model has different levels in which promotion programs can be implemented, including policy, community, institution, interpersonal, and intrapersonal. Exploring the social ecological model with respect to vaccination uptake could lead to better intervention strategies. I also focused on a health behavioral theory, extended parallel process model. This behavioral theory incorporates not only fear appeals, but also rationale considerations to determine health behaviors. Key variables for this model include perceived efficacy and perceived threat. Now let's jump into the literature review. I will mention a few key themes and factors that I found across several articles. To focus on social determinants of health first, racial disparity was something we saw over and over again. In one article, Black individuals were less likely to vaccinate than white, 43% compared to 63.5%. This disparity was exposed in nursing homes in Michigan. In another article, Black individuals were more skeptical about receiving the flu vaccine. This was predicted to be due to racial consciousness and perceived discrimination in healthcare fields. In another article, there was found to be higher vaccination rates among the Black population when there was a higher educational background and confidence in the vaccine, as well as an increased perceived susceptibility. To continue with social determinants, an article found that foreign-born individuals were less likely to get vaccinated than U.S.-born individuals, 40.5% compared to 62.6%. However, it was noted that individuals who were in the country over 10 years were even less likely to get vaccinated than those foreign-born individuals in the U.S. for less than 10 years. Institutions seem to be another common theme throughout this review. Several articles found that institutions played a role in vaccines. One article found that individuals who use healthcare services more often are more likely to vaccinate due to a higher trust within the institution. This article also found that those who were married were more likely to visit the doctor's office more often and to get vaccinated. A different article compared for-profit nursing homes to non-profit nursing homes and showed that for-profit nursing homes had lower vaccination rates than nonprofits. This was due to what was believed to be staff time constraints and suggested moving forward to have an incentive program for workers within the facility to promote vaccination. Knowledge, attitudes, and beliefs are an important theme to discuss when examining vaccines and vaccine hesitancy. In an article, perceived threat of complications from influenza seemed to increase vaccine uptake in the elderly population. In this study, 53 out of 100 participants did not intend to be vaccinated, according to a survey they had taken. However, after physician consultation, 34 out of the 53 patients change their mind when warned about the risk of myocardial infarction discussed with their physician. In another article, risk perceptions of influenza in the United Kingdom were examined by face-to-face interviews with individuals. Vaccinations seem to be driven largely by the individual's risk perceptions of the disease, including perceived susceptibility, severity, and likelihood of catching influenza. The general practitioner's recommendation also showed to play a role in vaccine uptake. A separate role examined government recommendation of vaccines. After the H1N1 pandemic of 2009, a closer look was taken at vaccine hesitancy and the relationship between willingness to vaccinate and confidence in social institutions. The 65 and older age group was observed that they were more willing to get vaccinated because they were more willing to trust the government recommendation than younger groups. Overall, this study revealed that trust in institutions is needed to deal with an epidemic outbreak. Based on this review, there are several suggestions I would make moving forward. With respect to social determinants, the biggest disparity was observed to be a racial one, between white and black individuals. Focus needs to be placed on reducing perceived discrimination in the healthcare field. Also, based on what we found and the social ecological model, an intervention would best be applied at the institutional level, specifically focusing on trust and a healthcare provider-to-patient relationship. This population will be less likely to question the effectiveness of the vaccine, and healthcare providers can increase perceived threat for individuals, and this could even help to reduce perceived discrimination, as previously mentioned, if the trust at an institutional level is improved. As far as low vaccination rates in nursing homes, further exploration is needed in order to find a successful intervention strategy for this specific cohort. On this slide, you can find the references used throughout my final paper and presentation. Thank you for listening. If you have any questions, please feel free to email me.